Hello, and welcome back to another episode of the Residency Match Insider. And I am Jonathan Munoz. I'm going to talk to you today about the nursing exodus, nurses leaving their states for higher paying jobs, and how is this going to affect this residency year. And why I'm saying that it's going to affect this year, because in some states, not all of them, but in some states, residents are in charge or asked to do things that are considered scat work or extra work, not scat work, but I would say extra work that they shouldn't be doing in an ideal scenario, like, for example, drawing blood, um, calling outpatient clinics to schedule follow-up appointments, faxing documentation, requesting documentation from other hospitals, um, sometimes consulting specialists. And so why am I saying that these things may change? These situations will probably get worse in the next year, is because a lot of the nurses in their states are leaving for other areas that are in crisis condition that need nurses for higher paying. Not only higher paying, some do it for the call of serving areas in big distress. We're very appreciative of this, but it does mean that some areas, some hospitals, some states will have a shortage of nurses, where the nurses will be very busy, and things that you were expecting to happen that day, for example, a patient that needed to be transported from his room to the MRI machine with a nurse, um, won't be happening early on the day, or it might even need you to transport the patient, because some of these patients need to be transported with someone that is trained on doing CPR, resuscitating measures, calling the right people at the right time, and so the residents may be asked to do that. So we will see what happens this year, but I expect that this might be the situation for many hospitals that are currently understaffed, and this is a situation that's happening because of the new traveling nursing opportunities that are appearing all over the state, where nurses are paid twice as much as what they were making before. And yeah, it's enticing. It's very motivating for someone to move to other states, but leaves a real shortage of nurses in some areas. So we'll see what happens, but I'm expecting that this is something that may impact the this year residency programs. And so be be prepared for extra work, be prepared for having an open mind, and do what is best for your patients, which in some circumstances will be for you to have to transport your patient, roll them in their wheelchairs to the MRI machines, to the CT scans, to do their blood work, to call at discharge time, to arrange for a follow-up appointment with their doctors, and to call the consultants yourself. Sometimes in some hospitals, the nurses are the one calling consultants. Expect delays on testing. So we will see what happens, but that's something I wanted to talk to you about. The Is the current shortage of nurses. So thank you.